We have the Chief of Staff of the Guyana Defense Force, Brigadier Godfrey Best, Commissioner of Police, Mr. Nigel Hoppy, Head of the CDC, Lieutenant Colonel Kester Craig, and of course, Dr. Leslie Ramasamy, Advisor to the Minister. This afternoon, starting with the Prime Minister, the members of the panel will make presentations, after which they will take questions. Mr. Prime Minister.
Thank you, moderator. Members of the media, good afternoon. As the National Coordinator for the COVID-19 Task Force, it is important that we meet today to brief the media and to brief the people of Guyana on the measures that are necessary to curb the spread of COVID-19 in Guyana. You all know COVID-19 is a pandemic that is affecting every country in the world today. And today we're going to speak about Guyana. I want to start by telling you, the media, and the people of Guyana that COVID-19 is a killer. I want it to register. And by adhering to the measures, you, the people of Guyana, will be saving your own life and saving the lives of the people that you interact with. So it's important that all of us, as individuals, as head of households, as leaders in the community, as leaders at the regional and at the national level, not only add our voices, but practice the measures. And here I'm saying to all Guyanese, start by wearing a mask. And I'm happy to see everybody in here with a mask on. And we want all the people of Guyana to do that. Start by wearing a mask. Secondly, if you don't have to leave your home, don't leave your home. If you have to leave your home, remember, put on the mask before you leave your home. Practice social distancing and sanitize as many times as possible. Sanitize, wash your hands, soap, with whatever you have sanitizer, use it. Sanitize your surroundings, your home. These are the measures that will save your lives. We have reduced the curfew hours. You know, the curfew for the last month, the month of September, which incidentally is the month with the highest deaths from COVID-19 so far. We had a 6 p.m. to 6 a.m. curfew. We have changed that, and now we have a 9 p.m. to 4 a.m. curfew. We have not reduced or relaxed the measures for anyone to go out there and party and socialize and feel more relaxed. There's a simple reason why we did it. So people could conduct their activities, whether it be work, the place of business, farming, and get home to their families. And get up early in the morning to start their activities again. So whether you're a farmer, whether you're a fisherman, and you have to get up early and get out to sea or get your goods to the market, so they could start selling at 6, that is the reason why we have changed the timing. Not for people to have longer hours to party. This is serious business. And if you want to stay alive, now is the time to stop partying. Now is the time to wear the mask. Now is the time to encourage all around you to wear the mask, to practice social distancing, and to sanitize. very important. The PPPC government has demonstrated its commitment to this fight against COVID-19, notwithstanding what is peddled in the wider society. From the time we took office, we have initiated a number of policies and activities to aid the fight against COVID-19. As recent as our budget, we have $150 million that were voted for the frontline workers. When we came into office, this country had just about 2,000 testing kits. And we heard about that. And you in the media would have heard about that for 5 months, that Guyana had 2,000 testing kits. We've changed that. Within the first week of coming into office, we had 10,000 testing kits flown into this country. We have, since we got into power, we have already procured over $500 million in personal protective equipment for frontline workers. And we have received over $300 million in aid in the form of PPEs and other necessary equipment from partner countries and organizations. We have started to issue out $25,000 per household. And you'll hear more about that and other forms of assistance later. When we came into office, we met a health system that was testing just about 20 to 25 tests were being done per day. And today, we are testing 300 tests are being done per day. And that will be increasing as we go along. We have the private sector who is working with us, and I dare say that the private sector is contributing because of the environment that we created on assuming office, the political climate that we created. The private sector has continued to contribute towards this effort in a more meaningful way. And hats off to the private sector. And also, I wish to compliment our frontline workers, our doctors, our nurses, our health visitors, who are out there working hard to help to curb the spread of COVID-19 in all 10 administrative regions. And it's very important that all people of Guyana respect the work of our frontline workers and adhere to the measures. No amount of equipment will contribute in a meaningful way to save lives in Guyana than if we all as a people adhere to the measures. That is what will have a significant impact on saving the lives of the people. Wear your mask, wash your hands, practice social distancing. Leave your homes only if you have to leave your home. Don't gather for parties. That is not the reason why we have placed the time from 9 p.m. to 4 a.m. We've done that to facilitate everybody being able to conduct their activities and also practice the measures. The measures is what will keep us alive as a people. The measures is what will curb the spread. Adhere to the measures. The measures is what will save lives. And save your life, save my life too. I have a lineup of speakers who are better qualified in their own areas, and I will now ask Dr. Frank Anthony to take the podium. And before I do that, I want to mention that we have a donation of 1 million N95 masks that is coming to Guyana very soon, thanks to the Demerara Distillers Limited and the Dubai Medical and Research Center. So here again, you see the private sector is playing an important role. So everybody, practice the measures and let us live a longer life together.
Thank you very much, PM, other colleagues at the head table, members of the media. As you heard, the Prime Minister, who is the head of the National Task Force on COVID-19, explain to you the rationale why we should take these preventative measures. We have, over the last month and a half or so, been actively engaged in repurposing our response to COVID, and we have done that in a number of ways. Apart from the coordination and apart from setting policy, we have two main pillars of our response. One dealing with the health response, and another looking at socio-economic aspect. And maybe a third that where we're going to explain more of that in a few moments here, which deals with getting people to be more compliant with some of the measures that have been put in the order over the last few months. Looking at the health response, as Prime Minister mentioned, when we took over, we had very little testing happening, and we have spent an enormous amount of resources in trying to build and lift our testing capacity. We are now able to do more testing, and we are seeing, by doing more testing, we are seeing more people who have tested positive. We are going to continue to build that response, and very shortly at the National Public Health Reference Lab, we are going to add 2 additional PCR machines, and we are going to be able to process samples faster. Today, we receive a special piece of equipment, which by next week we are hoping to put into operation, that can increase the capacity, the speed with which we process samples. So with that, with the use of that equipment, we will be able to increase our capacity even more. So that's with testing. We have also looked at our capacity to hospitalize people if they get sick, because we know that the percentage of persons who get sick would require hospitalization. We have expanded the capacity at the Georgetown Public Hospital, where more of our severe cases come, but we have also expanded the capacity of almost all the regional hospitals. The Georgetown Hospital, we have created a special infectious disease intensive care unit, and that unit has been working, and we have been equipping them with a number of equipment to help persons who are in those ICUs to be able to breathe better. These types of equipment include ventilators, it includes BPAP machines and CPAP machines at the Georgetown Hospital ICU. They have all these relevant types of machines. As of the 12th of October, we'll be getting in another 21 ventilators, and these ventilators are going to be distributed to the regional hospital. We have already commenced training for the doctors at the regional hospitals, so that once these machines are in and distributed, they would be able to utilize them if they have such patients. In terms of treatment, there's no magic treatment for persons who have the severe form of COVID. But what we have done is all the medications that other countries have been using, we have ensured that our doctors are able to have access to those types of medication. Those medications include things like ivermectin. It also includes things like remdesivir. We have brought in 2,000 doses of remdesivir, and our most severe patients have been benefiting from remdesivir treatment in our ICU. In addition to expanding capacity and making sure that we have the right types of medicines available for treatment, we have also decided that we can only exit this pandemic if we have a vaccine that is going to be made available to us. We are going to participate in some of the trials that are being conducted by the WHO, and they have invited us to participate, and we are currently doing the necessary paperwork to do that. We also have benefited from a facility called COVAX, and COVAX is a funding facility for vaccines, and they are currently looking at 15 candidate vaccines, and whichever vaccine is successful during the phase 3 trial, we would be able to access doses through the COVAX mechanism. So that is going to help us with exiting the pandemic, because once we have the vaccine available, and it is an effective vaccine, it is our exit out of the pandemic. As you know, most countries are waiting on such a vaccine so that they too can exit. But we have concretized our relationship with COVAX. We have signed all the agreements, and therefore, once that vaccine is available, we would be able to do so. Now, when we talk about prevention, it is not only waiting for a vaccine. We can do something immediately. And what we can do immediately are some of the things that the Prime Minister has already mentioned. The only way we can stay safe is that we have to take the known precautions. The first one is to wear our mask. And we are doing that not because we want to punish people and to have them wear a mask. We are doing that because there's a logical medical reason why you should wear your mask. There are people who are asymptomatic, meaning they have no signs or symptoms of the disease, but they can be infective because they themselves carry the disease and they can infect others. Those persons, we don't know how to identify them. Unless we do a PCR test, we wouldn't know that they are positive. And so they walk around and they look healthy and everything like any person else. They don't cough, they have no fever, but they can be infectious. And they can spread that disease, and the way they spread it is that if they're in your presence and if they're talking to you, right, that the droplets that come out from their mouth can infect you. So wearing a mask protects you from such persons that you might come in contact with. We have been emphasizing this through our communication strategy, but we still see there are many, many persons who do not wear a mask. And if they don't and they get infected, a percentage of those persons are going to end up in the hospital. From the persons who have died so far in our country, we are noticing a trend. We are noticing that older persons are more at risk to get this disease. Their risk goes up once they're older, and if they have underlying conditions such as diabetes, hypertension, cardiovascular diseases, and so forth, that their risk increase. And we know in our population there are persons who might have more than one condition, which increases their risk. So from the persons who have died, many of them have had these underlying conditions, plus we have a number of persons who are old. But that is not the only set of people that are dying. We have seen younger persons who have come into the hospital, had the most severe form of COVID, and they also died. So this is a serious thing. And I think there are too many persons in our society who felt that because they're young and they can move around, they don't have to take these precautions. Now, even if you're young and you're moving around and you are not getting it in the most severe way, in many cases we have seen spread where they take it back into the home and older persons in the home are getting sick. So we all have to ensure that we play our part. And so one of the things that we are doing today is we are going to intensify our operations as it relates to people wearing masks. And later on we'll unveil to you what we mean by that. Because many of you have spoken to us and said your enforcement is lacking. Well, we are going to be able now to put more people out on the road to ensure that people are complying with mask wearing, complying with keeping social distancing, and so forth, because this is absolutely necessary if we are going to curtail spread. So as of today, you will see that operation go into effect, and you will see more people being out there to try to work with the general population in terms of containing the spread. So I'll stop here for the minute, and I'll ask the other colleagues to be able to explain to you some of the mechanics of the operation that we'll be launching to get more people to comply with mask wearing, social distancing, and hand sanitizing. Thank you very much.
Thank you very much, Dr. Frank Anthony, Honorable Dr. Frank Anthony, members of the media. In this whole of government intensified approach, on the relief and enforcement side, the Guyana Defense Force will be collaborating with civil society and citizens across all regions and sub-regions to educate and encourage all Guyanese to adhere to the national COVID-19 regulations. This engagement will in fact be in the form of joint services effort. The GDF will deploy no less than 500 troops alongside relevant stakeholders and partners, and we will interface with citizens utilizing a soft, cogent approach to ensure that citizens wear masks and wear them properly, practice social distancing, adhere to the restrictions of social events and curfew timings. And we will also continue to improve the security of the unofficial entries into Guyana at our borders. I call on all citizens and residents across all communities to cooperate and collaborate with us to get this job done. Your safety and the safety of your beloved ones are of paramount importance at this time. Work with us to ensure that Guyana and all fellow Guyanese, as well as those who have made Guyana their homes, rise above this current situation. No other person needs to become infected. No other person needs to die of this pandemic. We owe it to ourselves and our fellow Guyanese to look out for each other. Guyanese are resilient persons. We must stem this tide of this infection and ultimately reduce the number of persons who will succumb. Let us be our brother's keepers as GDF intensifies its efforts to help in this fight against COVID-19. Thank you very much. I now call on the Commissioner of Police.
Thank you very much, Chief of Staff. Honorable Prime Minister, Honorable Minister of Health, other members of the distinguished members of the table, members of the media, all. I, sir, would just like to echo the sentiments expressed earlier by the three persons who would have spoken before me. But just to say that the new COVID-19 measure, number 10, is effective today, the 1st of October. Number 10 is effective the 1st of October 2020. New measures and restrictions have been put in place to ensure that persons, their family, as well as our community and the country as a whole are safe from this pandemic, which has in recent past has seen growing numbers as identified by the Prime Minister and related deaths in Guyana and worldwide. The Guyana Police Force is in the front line in the fight against this COVID-19 virus in the country in terms of enforcement of the regulations as stipulated in the emergency measures. Towards this end, the Guyana Police Force, in a community-minded approach, will initially embark on a continuous public education and advisory campaign in order to sensitize members of the public of their individual responsibility in this matter. The approach, as identified by the Chief of Staff, take effect Thursday today and will see members of the joint services, which include the Guyana Police Force, along with other key stakeholders working assiduously in this combined effort throughout the country. It is my sincere hope and expectation that our efforts will be effective in contributing to a decline in the COVID-19 statistics in Guyana. I just want to call on all to adhere to these measures. Thank you.
Honorable Prime Minister, Honorable Minister of Health, and other members of the head table, members of the media, good afternoon. The Civil Defense Commission will continue to support all the agencies in providing humanitarian support to persons affected by COVID-19. The Commission works with international organizations, non-governmental organization, and the private sector to ensure we have the necessary relief supply to distribute to residents across Guyana. To date, we have distributed approximately 10,000 relief supplies to all 10 administrative regions in Guyana. Apart from that, we have supported the Health Emergency Operations Centers and the regional emergency operations centers across the country in ensuring that they relieve adequate relief supply to support the operation, also support those persons in isolation and in quarantine. Through support from the Caribbean Disaster Emergency Management Agency, we have received gloves, masks, personal protective equipment, and those equipment were handed over to the Ministry of Health and also to the regional response mechanism to continue to fight COVID-19. That is the posture we will continue to operate on going ahead, and we will continue to support all agencies in executing their work. Apart from supporting those agencies in providing those needed supplies, we have been working closely with international organizations. For example, we have worked with UNHCR to set up a total of 52 housing units across this entire country. And those housing units are used to house people in isolation and people in quarantine. So we would like and continue to have those support with those international agencies. Their support is invaluable to the response. Fighting COVID-19 is not a one-person responsibility, not only the government responsibility, but it's the responsibility of every individual. So the Commission will continue to work with all stakeholders. We continue to ask the private sector, the international agency, to provide the necessary support, and we will work with the regional counterpart, the communities, to ensure that those support get to the citizens. So I'd like to thank them for the support and continue to look forward to working with you. Thank you.
Thank you to all the speakers. Before we go into our question and answer phase, I would like to take this opportunity to effectively launch Operation Covicorp. C-O-V-I-C-U-R-B, Operation Covicorp. And as the name implies, it is an operation to curb the spread of COVID-19 in Guyana. We want to focus on education, moral suasion, communicating aggressively throughout the length and breadth of Guyana, and finally, to use enforcement measures to help to curb the spread of COVID-19 in Guyana. This is an operation that is now launched, and it will grow on us over the next 72 hours. It will involve members of the Joint Services, as you heard earlier, and we will have volunteers from the youth, from the women, from the older folks, from the private sector. Everybody wants to volunteer and add their voice and add their time and their energies towards helping in whatever way to curb the spread of COVID-19 in Guyana is welcome. And we envisage that within the next 7 days, we'll have over 5,000 persons operating in a multi-sectoral, interagency setting, working throughout Guyana to curb the spread of COVID-19, speaking to our people, issuing flyers, and having sessions whether on social media, private, and the government-owned media, all in an effort to educate our people to adhere to the measures. We'll also set up a hotline, so if you see somebody who's not following the measures, not adhering to the measures, you can call us, and the enforcement agencies, of course, will quickly rush down and try to, of course, start by using more persuasion, right, to enforce these measures. We want to appeal to the people of Guyana that we're all involved, and we must all be involved in this operation, Covicorp. That's the only way we can do it. We are brothers keeper, we are sisters keeper, we're all involved, or we'll all be consumed. COVID-19 is a killer. Support Operation Covicorp. Thank you.
Thank you very much, gentlemen. The floor is now open for questions. What you will do is to state your name and the media house you're representing before you proceed with your questions. There's a microphone around that you'll use. At the head table, you can use the microphone right in front of you to respond.
In every region, we have several regional divisions, and it's an effort to ensure that the presidency continues to get significant number of police shots to be deployed to ensure we address this issue. To speak specifically to the number, we haven't said there is 1, 2, 3, 10, or 500, but what I know is that all around will be aware and they will work towards ensuring
Dennis Shabab.
Mr. Prime Minister, to what extent the decision to reduce the curfew hours is influenced by the decision to revive business activity in the economy. And secondly, sir, what scientific evidence you have that reducing the curfew will in fact not result in even further escalation of the disease?
Before I ask the expert to deal with the scientific aspect, the reality is we cannot keep the people hemmed in and not be able to conduct their normal activities. That itself will lead to some form of protest, some form of rebellion against what we want to achieve. We want to achieve a curb in the spread of COVID-19. The reality, people have to live, right? They have to get food, they have to get water, people want to go to work, okay? And we have to find the right balance. You're aware that because of COVID-19, a lot of people will have lost their jobs, okay? So people still have to have some form of economic activity going for them. We still have to eat, the farmers still have to farm. The fishermen still have to bring in fish, okay? So we have to strike the right balance where people could have an opportunity to conduct the normal activities, but at the same time observe the measures. And we believe that curfew, while curfew, the traditional 6 to 6 curfew may have its effect, what is more important, as people interact, they interact by observing the measures. Wear a mask. Interaction without a mask versus interaction with a mask. Which one is more beneficial to curbing the spread of COVID-19? Obviously, interaction with a mask. If you have a mask on, I have a mask on, we can interact, we observe the social distancing, and that itself helps us curb the spread of COVID-19. In terms of the scientific side, I will now ask Dr. Frank and before that.
Thank you very much, Dennis. I think that's a very important question. When we were looking at measures, we took two sets of things into consideration. One is the epidemiological situation, which we know we are getting increase in cases. But we also took into consideration what is happening with people's livelihoods. We had a survey that was just completed and released by the United Nations. It's called the Caribbean COVID-19 Food Security and Livelihoods Impact Survey. And among the things that came out in that survey is that 6 out of 10 respondents have experienced job loss or a decline in salaries in their households. And they were comparing between April, when that was just about 35%, and now, which is close to 65%. So you can see what the Prime Minister just spoke about in terms of job loss, that it's not just us imagining this, but this is actually happening to people. Some of those who were interviewed, when we look at disruptions to livelihoods, they said disruption to livelihoods were very widespread. Nearly 2 in 3 respondents reported that their ability to carry out livelihoods were impacted mainly out of concern for leaving home, movement restrictions, and so forth. You had other things like ability to get food. And in one of the statistics here, it shows that when they interview people over the last 7 days, the stock of food that they have, in some cases 5% of the people who were interviewed said they didn't eat for the week. You have persons who have to skip meals, eat less than they would normally eat. You have that being about 29% of the people who were the respondents. you have a whole list of things here. So what we're trying to do is to have a balance between protecting lives and also livelihoods. And that balance, we feel that if we increase or reduce the hours of curfew, that people can be allowed to carry on with their economic activity, but under the rules. And these rules include that they have to wear their masks, they have to keep social distancing. When you don't have curfew, it doesn't mean that you just carry on, take off your mask and do whatever you want. It means that you have to abide by rules. And these are the rules: social distancing, the sanitizing, wearing the mask, which is absolutely important. And that is why we're taking this measure of Covicorp to be able to reinforce that messaging so as to reduce transmission. So it was something that we thought about, and we know that we were lagging a little bit with the getting people to comply, and we feel by now with this broad involvement that we'll have more compliance. So we need your support, we need immediate support to be able to get this messaging out and get more people to comply with the measures that we're taking.
Right. Health Minister, what I'm also trying to ascertain from you is whether you have any scientific evidence based on experiences elsewhere, perhaps, whether indeed reducing the curfew hours, along with all the other measures that you referred to, will indeed not result in an escalation in numbers, as we've seen over the last few weeks. As after my point, sir, there is a claim by the public service unions early today that several doctors at the West Camara Hospital have been tested positive, and they were seeking to have a second test done, and they refused, and they're still on duty. And to the police commissioner, sir, what are your specific steps you will take to ensure that these measures are enforced? So probably the minister.
The one dealing with the medical doctors, I know about a week ago we had two persons at West Camara Hospital who tested positive, and they were isolated. So I don't know of anyone who's tested positive and is on the job. And if the instructions that the health system, that is in the health system, if there's any frontline worker that shows signs or symptoms or were exposed to a patient that was positive, then that frontline worker gets priority in terms of getting a PCR test done. So I am not aware that any frontline worker, whether a doctor or nurse, who has been exposed, trying to get a test and didn't get that done. From what I understand, that shouldn't be, but I would like to have the details so that that can be investigated, because if it did happen, it shouldn't happen. But I doubt whether that would have happened in any case.
This initially that we embark on initially on a continuous education program. We have members of the community that work closely together with the United Force. We have the chief staff also spoke about the joint effort along with other stakeholders. So we're going to be in the community engaging individuals, of course, we'll be observing the social distancing measure. But informing them how important it is first and foremost to adhere to the measure. So we would an approach that would see us embarking on more and more restriction initially before we get to the aspect of enforcement. Of course, we will be warned, and if there's an adherence and a compliance, then we have to go to that measure for enforcement.
Commissioner, how do you account for what has been observed in some areas? Only a couple of days ago, I think it was Sunday, there was a report of a house party just opposite the Alberton police station no enforcement. When you pass by the Starbucks Market at nights, buses are there after the curfew hours, right in front of the police outpost, and no action is being taken. What do you say of your enforcement capacity when one looks at that?
One of the things I'm aware of is as long as these incidents are brought to the attention of members of the police force, we do try to address them. In some instances, there may be challenges in terms of the requisite resources to deal with it in a holistic way. But as soon as it's brought to our attention, for example, the Starbucks incident in Covicorp, we will go down there and ensure that there are some procedures in there.
I wish to add the Commission Police answer that if there is a breach of the regulations by business places, they will be given a warning in the first instance. A second breach will result in closure of their business. That is what we want to communicate clearly across the area. First time warning, second time closure. COVID-19 is a threat to national security right now here. That's how I want everybody, that's how we want everybody to look at COVID-19. It is a threat to our survival as a people. It is a threat, therefore, to our national security. That's why we have to adhere as a people to these measures. If you want to remain as a country, as a state, known as Guyana, all of us, all hands on board, must play a role in curbing the spread of COVID-19. It is a threat to national security. The foremost threat to national security right now is COVID. And to add to that, it transcends politics. And I want to appeal at this stage, whether you're in opposition or whether you're government, what is important, all of us must now play a role in curbing the spread of COVID-19. Yes, you can criticize what has been done by the government, but let's go beyond criticism. Get involved, right? Get involved in finding solutions. Get involved in spreading the message. Get involved in curbing the spread of COVID-19. Get involved in ensuring people adhere to the measures. That is what is important for all guys.
The Minister at Guyana Chronicle. Prime Minister, it was reported that government will be reopening the airports on October 12th. Can you say what led to this decision and possibly say what are some of the protocols that will be or have been established to regulate the reopening of these airports?
There is a demand for the reopening of the airport. In a simple sense, that is what has led to our starting the discussions. However, we will not just reopen the airport, as we mentioned. There are a number of protocols that we have to put in place, and that's why we give ourselves until the 12th. No reopening before the 12th of October, as in the measures, and we will take the opportunity between now and the 12th to put the protocols in place. I don't want to, we'll have a briefing, once the protocols are decided on. I will communicate that to everybody. But the bottom line is, no one will be allowed to travel into Guyana without first doing a COVID-19 TRC test and PCR test, and having tested negative. That's the only time they're allowed to board the aircraft and come to Guyana. If you test positive, you cannot come to Guyana. And as I said before, the details, I don't want to give the details now because we're still having discussions, right? But the bottom line is you have to have a a negative PCR test within a certain timeline that will be disclosed later before we could board a plane to come to the airport.
One more question. Minister Anthony, can you give us, can you say what is the status of the COVID-19 hospital?
I guess you're referring to the facility at Ocean View, right? So right now we have 29 patients here. We had to do some major works on the eastern side, and some of that work is continuing. We are hoping that once those works are completed, that we will move those 29 patients that we have here into that section. We have brought in some people to look at the area designated for the ICU, and we are, in the next coming weeks, we will be putting in the system for medical gas to be able to flow into that area. We have also looked at the area for the diagnostic area, which includes things like x-rays, and we are in the process of procuring the relevant equipment so that we can put that section into operation. We have also, on the upper floor, we have looked at, we have already put beds in there, but we have not activated that section per se, and that is another area that we will be activating shortly. So plans are in place to do it in a phased way as we continue to fix some of the infrastructure works that was left. We have to do over that whole eastern section with floors and all of that, with piping and things like that. And as we speak, we are also working on the area for sewage. We are also working on water storage tanks or a reservoir because these things were not there. So these are works that are ongoing. So even as we continue that work, we're still putting sections of the building into use.
Sure, Mr. Professor, please. The Pan-American Health Organization director has said that countries should start outlining plans for vaccination. Dr. Anthony, could you say whether there is discussion so far in talks about plans for vaccination programs whenever vaccine is available for COVID-19?
Thank you. That's a really good question. As I said before, we have been in contact with COVAX, and we're going to get vaccines when vaccines are available. And we have already started internal discussions so that we can have all the relevant equipment in place. So once the vaccine is available, we will be able to roll that out. So some of the things that we have started to do is to ensure that we have the things like the syringes, to make sure that we have cold storage containers, to come up with a plan of how we're going to deploy the vaccines, to retrain the existing workforce for immunization, plus we have to train others. Then we have to wait and see what type of vaccines that will become available. Because right now, some of these things are not determined as yet, whether it's going to be 1 dose or 2 doses, how long you have to spend before you do the other dose, and there are a number of other things that we have to look at. But we have already started doing that pre-planning, and we will concretize more of that as the weeks go by. So as soon as a vaccine becomes available, we will be ready to roll that out again.
I have two other questions. Earlier on, there's been an issue of cross-border movement to some of the Atlantic region. Would the Chief of Staff or the Commissioner of Police see what are the plans now to possibly stop that, as that has been something that to the increasing cases in those regions? And my second question would be, will persons who are entering Guyana after the airport open, will they be allowed to travel to the hinterland region?
In region 1, 7, 8, and 9, indeed we had that issue where there are lots of unofficial correspondence, and we found that indeed persons from Tanzania and Brazil, two of the countries that have persons high rate of infection, were attempting to come across the Guyana. Consequent of that, working along with the national COVID task force in those regions, the United Defense Force has intensified our operations there. We've opened additional checkpoints. We have also sent to those regions additional resources, including boats, and we are working along with the community in there to ensure that we continue to police and secure our borders, thus stopping and stemming that flow of persons that are coming to Guyana unchecked. We continue to work in that regard, and there have been great improvements in stopping the flow, the inflow of persons into Guyana unchecked.
Thank you very much. Another question?
The second part of your question was, if somebody comes into the country, whether they be allowed to travel.
To the hinterland region?
Right, so once they are PCR negative, they will be allowed to travel. You don't have any restrictions once they are PCR negative.
All right, Prime Minister will close, I think, the questions. Dennis, you have another question?
Just a quick clarification here. I know you said that the protocols will be detailed in the not-too-distant future, but in terms of the PCR testing, when people come to Guyana, will they be required to have an northern PCR test done on arrival?
So basically the protocol that we looked at, and this will be in effect for all the repatriation flights, right? You have to get a PCR test done at your point of origin, and once you're negative, you're allowed to come on the flight. That has some time restrictions. If it was more than 7 days, they were not allowed on the flight. So we'll continue to hold that time period. Once you arrive in Guyana, ideally we want you to have your PCR test done at your point of origin. And that PCR must be done within 72 hours. If you exceeded that 72 hours, and say you were at 4 days or whatever it is, and you come with such a test, at the airport, you will be required to do another PCR test at the airport. So the mechanisms will be put in place so that you can be swabbed, and that test will be done. And once that test is done, you will get back your result within a reasonable period of time. And then if you were negative, you will be allowed to proceed. If you were positive, well, then you will have to be isolated. So that's the basic process that you have. So literally, you will be screened twice at the point when you're leaving, at the point of origin, and then when you come here, you do a second test, literally. So we are hoping with this measure, you would minimize anyone's to be passed these 2 tests. So it's really a safety net here.
As we close, I like to thank the media for being here and also for your continued role in spreading awareness as to the need for all of us in Guyana to be part of this whole operation to curb the spread of COVID-19 in our beautiful country by ensuring that the message is spread throughout Guyana as to the importance of adhering to the measures that we outline in all our presentations. Wear a mask. COVID-19 is a killer. Protect yourself, protect your neighbor, protect your family. Wear a mask and ensure anybody next to you wear a mask. And of course, practice social distancing and sanitize, sanitize, sanitize. Thank you for the role that you've played so far and you will continue to play in curbing the spread of COVID-19 in Guyana and in making our people aware